Imagine eating something you've been told your whole life is good for you. Something doctors often recommend. Something many seniors eat almost every day, and then finding out it could quietly increase your stroke risk overnight. Cardiologists are stunned, researchers are debating it, and most people over 60 have absolutely no idea this is happening inside their arteries right now. For decades, we've been taught a simple rule: eat more vegetables, protect your heart, live longer. And in most cases, that advice is true. Vegetables are packed with vitamins, minerals, and protective compounds. But here's the uncomfortable truth modern medicine is now confronting. Not all vegetables behave the same inside an aging body. And one very common healthy vegetable may be doing the exact opposite of what you expect, especially after age 60. This isn't fear-mongering. This isn't about eliminating vegetables or pushing extreme diets. This is about understanding how your body changes with age, and how certain foods can suddenly become a problem when blood vessels stiffen, kidneys slow down, and inflammation quietly rises. Stroke doesn't usually arrive without warning. It builds silently, tiny changes in blood thickness, subtle damage to artery walls, small clots forming and dissolving, until one day, one doesn't dissolve. Doctors used to believe strokes were mainly about cholesterol, salt, or lack of exercise. But now, research is showing that certain plant compounds, when consumed frequently and in large amounts, can raise clotting risk, spike blood pressure, or interfere with blood vessel function, particularly in seniors. And the vegetable we're talking about today? It's eaten in salads. It's blended into green juices. It's often praised as a superfood. Many seniors eat it daily. Let us talk about what doctors are now discovering and why this vegetable may raise stroke risk faster than you think once you pass 60. As we age, our blood naturally becomes more prone to clotting. This is not a disease, it's biology. The liver produces more clotting factors. Blood vessels lose elasticity. The inner lining of arteries, called the endothelium, becomes more sensitive to irritation and damage. Now here's where diet enters the picture. There are certain nutrients that directly affect how thick your blood is and how quickly it clots. One of the most powerful is vitamin K. Vitamin K plays a crucial role in blood clotting. Without it, wounds wouldn't heal and bleeding wouldn't stop. But too much vitamin K, especially sudden spikes, can tip the balance toward excessive clot formation, particularly in people with existing artery plaque, irregular heartbeat, or slower circulation. Doctors are now seeing a pattern. Seniors who consume large, consistent amounts of very high vitamin K vegetables may unknowingly be increasing clotting potential, especially if they're already at risk. And the vegetable highest on that list? Spinach. Yes, spinach. Often labeled one of the healthiest foods on the planet, spinach is extremely high in vitamin K. 1 cup of cooked spinach can contain more than 4 times the recommended daily intake. Raw spinach smoothies? Even higher. For younger people with flexible arteries and fast metabolism, this usually isn't an issue. But after 60, the story changes. Many seniors already have narrowed arteries, silent plaque buildup, slower blood flow, and diagnosed atrial fibrillation, or are taking blood-thinning medications in these bodies. Sudden or excessive vitamin K intake can interfere with normal blood balance. Doctors are particularly concerned about seniors who drink green smoothies daily, eat large spinach salads every night, combine spinach with supplements, or take blood thinners like warfarin. In these cases, spinach doesn't just cancel medication, it can create unpredictable clotting behavior, which is one of the most dangerous conditions for stroke risk. But even seniors not on blood thinners may be affected. Here's why. Spinach is also high in oxalates, natural plant compounds that can bind minerals like calcium and contribute to vascular irritation in susceptible individuals. In aging arteries already dealing with microdamage, this irritation can worsen endothelial dysfunction, a key driver of stroke. Then there's nitrates. Spinach contains natural nitrates, which can be beneficial for blood flow in some people. But in others, especially those with compromised nitric oxide pathways, nitrates can cause sudden blood pressure fluctuations. Rapid rises or drops in blood pressure are a known stroke trigger in older adults. Doctors are not saying spinach is poison. What they are saying is this: after 60, spinach is no longer neutral. It becomes a powerful biological signal, and your body may not handle it the same way it once did. This explains why some seniors do everything right: eat vegetables, avoid junk food, exercise lightly, and still suffer an unexpected stroke. It's not about one meal. It's about daily exposure over years, interacting with an aging cardiovascular system. In the next part, we'll look at the warning signs doctors see before a spinach-related clotting event, the silent symptoms most people ignore, and how much spinach is actually safe after 60 without giving up vegetables altogether. Doctors often say the most dangerous strokes are not the dramatic ones. They read the ones that were predictable but quietly ignored. Long before a clot fully blocks blood flow to the brain, the body usually sends subtle warning signs. The problem is most people don't connect these signs to something as innocent as a vegetable. In seniors who consume large amounts of spinach regularly, doctors have begun noticing recurring patterns. Not proof on its own, but enough to raise serious concern. One of the first signs is unusual morning dizziness. Not the spinning kind, but a heavy, foggy feeling in the head, especially after waking up. This can be caused by subtle changes in blood thickness overnight, when circulation naturally slows. If blood becomes slightly more prone to clotting during sleep, oxygen delivery to the brain can drop just enough to cause that foggy sensation. Another common sign is cold hands or feet, even in warm weather. When blood becomes thicker or less flexible, the body prioritizes vital organs, reducing circulation to extremities. Seniors often blame this on age or poor circulation, but doctors now see it as a potential early clotting signal. Then there's sudden blood pressure instability. Numbers that were once stable may start swinging without explanation. One day it's normal, the next it's unusually high or low. This volatility stresses the blood vessels in the brain and increases stroke risk dramatically. Diet-related nitrate fluctuations and vitamin K overload can both contribute to this instability. Many seniors also report frequent bruising or, paradoxically, slower wound healing. This sounds contradictory, but it makes sense biologically. When clotting pathways are overstimulated in some areas and impaired in others, especially when diet and medications clash, the body loses balance. Doctors stress this point clearly. Strokes are rarely caused by one factor alone. They're the result of stacked risks. Spinach becomes dangerous not because it's evil, but because it stacks on top of age-related artery stiffness, existing plaque, mild dehydration, reduced kidney function, inconsistent medication timing, and here's something few people talk about. As kidney function naturally declines with age, the body becomes less efficient at clearing excess minerals and compounds from the blood. This means the effects of high vitamin K foods can linger longer in seniors than in younger adults. What used to clear in hours may now influence clotting for days. This is why doctors are particularly concerned about overnight risk. At night, blood flow slows, heart rate drops, blood pressure changes positionally. If clotting tendency is slightly elevated due to diet, this is the window where small clots are most likely to form. This doesn't mean eating spinach once causes a stroke the next morning. It means repeated exposure builds conditions where a stroke becomes more likely, quietly, invisibly, and often without warning. Now let's talk about the biggest myth. Many people believe, if one vegetable is healthy, more must be better. That logic works for hydration and movement, but not for micronutrients like vitamin K. Doctors now emphasize consistency over quantity. Sudden increases or decreases in vitamin K intake are far more dangerous than moderate, steady amounts. This is especially true for seniors on blood thinners, but it also applies to anyone with cardiovascular risk. So what does safe look like? For most seniors, doctors suggest avoiding daily large spinach smoothies, rotating leafy greens instead of repeating the same one, limiting spinach to small portions, 2 to 3 times per week cooking spinach instead of eating it raw, which reduces oxalate load, and most importantly, never combining high spinach intake with dehydration. Even mild dehydration thickens the blood and compounds clot risk. This is where many seniors unknowingly get into trouble. They eat a spinach-heavy dinner, drink little water, sleep for 7 or 8 hours, and wake up slightly dehydrated, exactly when blood is most vulnerable. But here's the good news. You don't need to give up leafy greens to protect your brain. There are alternatives that provide similar nutrients without the same clotting intensity. In the next part, we'll reveal safer vegetable swaps, doctor-approved combinations that protect blood vessels, and the simple rule cardiologists now recommend to reduce stroke risk without fear, guilt, or extreme dieting. The goal is not to scare you away from vegetables. In fact, doctors agree that the right vegetables, eaten the right way, are one of the strongest defenses against stroke. The key is choosing options that support blood flow instead of quietly stressing it. This is why many cardiologists now recommend rotating leafy greens rather than relying on a single superfood. Instead of spinach every day, doctors suggest mixing in romaine lettuce butter, lettuce arugula, in small amounts bok choy cabbage, Swiss chard, in moderation. These greens still provide antioxidants, fiber, and minerals, but generally contain less concentrated vitamin K per serving or affect clotting more gently when eaten in rotation. Another important factor doctors emphasize is food pairing. When spinach is eaten alone, especially raw, its effects on blood chemistry are stronger. But when combined with healthy fats and protein, absorption slows and becomes more balanced. That's why doctors say if you do eat spinach, it's safer to cook it lightly, eat smaller portions, combine it with olive oil, fish, or eggs. Avoid consuming it late at night, drink adequate water with the meal. Timing matters more than most people realize. Doctors are especially cautious about nighttime spinach consumption. Eating large amounts of high vitamin K foods close to bedtime increases the chance that clotting effects peak during sleep, when circulation is slowest. Morning or midday intake is generally safer because the body is active, hydrated, and moving blood efficiently. Another overlooked factor is supplements. Many seniors unknowingly take multivitamins containing vitamin K while also eating spinach-rich diets. This combination can push levels far beyond what the body needs, without obvious symptoms. Doctors now recommend that seniors review supplement labels carefully, avoid stacking vitamin K from food and pills, discuss diet changes with their doctor if they've had heart issues, mini strokes or irregular heartbeat, and let's talk about mini strokes, also called TIAs. Doctors believe many seniors experience small, temporary clots that dissolve on their own, causing brief confusion, vision changes, or weakness that disappears within minutes. These events are often dismissed as fatigue or low blood sugar, but TIAs are one of the strongest predictors of a major stroke. Diet-related clotting imbalance is now considered a possible contributor in some of these cases, especially when combined with dehydration, medication interactions, and repeated intake of high-risk foods. This is why doctors are changing the conversation. They're no longer asking only, is this food healthy? They're asking, is this food appropriate for this body at this age in this amount? Spinach is not the enemy. Blind repetition is. After 60, health becomes less about superfoods and more about balance, rotation, hydration, and timing. Small changes, like swapping spinach every other day, cooking it instead of blending it raw, or eating it earlier in the day, can significantly reduce hidden stroke risk while still protecting the heart and brain. This is how modern preventive medicine works now. Not extremes, not fear, but smarter choices based on how the aging body actually functions. Stroke is one of those events people describe as sudden, but doctors know the truth. It's usually the final step in a long, quiet process. Small habits, repeated daily, slowly shape what happens inside the arteries and blood vessels over time. Spinach didn't become dangerous overnight. And it isn't dangerous for everyone. But what modern doctors are realizing is this. After 60, the body plays by different rules. Foods that were once harmless, even beneficial, can become powerful signals that push the system too far in one direction. This doesn't mean you should fear vegetables. It means you should respect balance. Health after 60 is no longer about chasing superfoods or eating the same healthy thing every day. It's about rotation, moderation, hydration, and timing. It's about understanding how aging blood vessels, slower kidneys, and subtle medication interactions change the way your body responds to food. The most important takeaway isn't stop eating spinach. It's this: no single food should dominate your plate every day. When you rotate your greens, cook them gently, eat them earlier in the day, stay hydrated, and avoid stacking supplements unnecessarily. You dramatically reduce silent stroke risk while still giving your body everything it needs to stay strong. Doctors aren't shocked because spinach exists. They were shocked because so many seniors were never told that too much of one healthy thing can quietly become harmful. Knowledge doesn't create fear, it creates control. And when it comes to stroke, control is everything. If this information helped you, share it with someone you care about, because the most dangerous risks are the ones we never see coming.